thank you for giving me the opportunity to speak today and spend some time with you. I start with this image because it reminds me of the deeper purpose of our work. Maybe I could ask you to spend a moment with yourself and ask yourself, what is the deeper purpose of your work? What is your purpose? Of course, we have our immediate purposes, the busy things that we need to do and the skills we must do and so on, but what does it serve? And during this talk, I suppose I'd just like to offer us the opportunity to reflect afresh on a reconnection to that original and deeper purpose that we have. I'm sure the words that will be coming to you will include elements of humanity and of genuine human caring, the issue of suffering and being with people in suffering, and where possible, the journey towards change, improvement, indeed transformation, and maybe even flourishing. This is our work. We work with human beings. Would you be kind enough to put up your hand if you feel this human side of care? The human side of care is under unacceptable strain in today's healthcare systems. Would you put up your hand if that you would agree with that statement? Have a wee look around. I've been asking that question of audiences in this and other countries, and nicknamed it for myself the conversation of 1,000 hands, because all the hands are going up. There is something so fundamentally challenging going on that the truth is at times it can feel quite overwhelming, and we need to almost not speak of it, not deal with it. And ask yourself, these hands going up, does it matter? Of course it does. It matters deeply. And there's something that's combining us all together, that's connecting us all together about this, and a desire to engage and to make some difference. And yet the journey is a difficult one and a challenging one. But the way I would put it is, the truth is we are combined in looking for a new way. And in this 50th anniversary of Martin Luther King's speech, it comes to me to remember he didn't say, "I have a complaint," when he stood up. And something about the vision that we're holding, the deeper vision of what is possible and the transformation of what is possible. And I want to share with you some of the work that my colleagues and I have been doing, reflecting on this and piloting models and wondering and contributing to conversation. And let me catch the flavor of the context of those hands going up, which even deepens the predicament for us. This is 25 people joining the WELL program, Wellness Enhancement Learning, a group-based program that I'll say more about later. And they're asked to write down on a bit of paper the main challenges to their well-being before they walk into day one. It's a very graphic story on this slide of human suffering. Yes, we could speak of the long-term conditions epidemics, nothing less, and that if you have one long-term condition, as you know, you're much more likely to have more than one. And if what we were doing just now, our deeper vision of what we're about, was working in a fundamental way, I don't think this slide would be like this. I think as individuals and as a community, we're beginning to acknowledge we need a deeper vision. Something is calling for change here. And I would say, we looked at the plan, do cycle that's been put in front of you. I would start that cycle not with the planning, personally. I would start it with the listening. I think action needs to be deeply informed, and I think that action has to be informed by a deep and connected listening to predicament and to feedback. And here's one morning, working in the pain relief clinic at the Royal Infirmary, I just asked people, how do they see their care to date? Do you recognize this? And you probably recognize it if one of your loved ones has been unwell or you've been a patient. It is the situation too often. But here's the intriguing thing. That was 1988. Okay? This train has been coming down this tunnel for a long time. And if we had chosen to listen more deeply and be more present with people, they would not only have told us what's wrong, but in their own analysis, they would have guided us on the vision of what's to be required. How are you doing at work? Secondary care and primary care, under the same sorts of pressures. A survey that we did some years ago showed that GPs are rushed 60% of every consultation, and that over 70% say they're prescribing when they otherwise would not have to because of these pressures of time and personal stress, and that the system design is causing excess referral into secondary care, which in turn is generating activity, investigations, prescribing, costs, iatrogenesis, and so on. There's a dense predicament for us all. Oh yeah? Well, I've lost the will to listen. Have you been there? Probably, eh? Healthcare workers are off more than any other public sector, and we're off the longest now. And the sick lines in the last year are now offering stress as the top line. You know, if we were going to sit down with a single individual to make change and a journey of change, the start point, and after we're beginning to build the safety and the trust and the space together, is listening and allowing the person to be able to speak that predicament. And in a way, that's what I'm trying to do for us collectively, not as an act of criticism in any way, and not in an attempt to dispirit us. Yeah, we must know where we start from. And next day at work, here's another group, same thing. High levels of mental stress, metabolic syndrome. But here's the thing, these are NHS staff. So we've started something called the staff well, when we realised that the staff are every bit as strained as the patients, and often no healthier, as you can see. And these are the staff who are still at work. Please note, this is a deeply concerning situation, I think. And it's to us that the person comes to say, how might I flourish in the modern world? How might I find my health and my balance and act in a way that would allow me to rebalance myself? And they're coming to us. And so I think change rings hollow here, and our improvement cycle could ring hollow if we're not actually addressing our own well-being. We don't have to have arrived. That's not the point of it. To be genuinely addressing the journey. And if these are the people we've looked at who've fallen in the river or perched on the edge, what of those upstream? What of our children? Is it good enough that they're going to end up on these slides? 2 out of 3 of them overweight, 45% of 15-year-old girls showing significant levels of mental distress. What are we to do to move beyond management of situations and into transformation of situations? And we know our children are being scarred, and as they grow, you'll have seen this. You might want to guess from the look on the face, which is a marker of the early nutritional development, which of these young men came from a deprived area. Something you may not have consciously struck before, but it is the one on the right. And as you see, the one on the left has a 10% chance of dying by the age of 60. The one on the right, a 50% chance of dying. We are in the depth of epidemics. Epidemics of distress and suffering and long-term conditions and degenerative conditions that our current map of the world is not successfully navigating or transforming. And this blank slide is the most important one I could offer, because it's the invitation to dream, and it's the invitation for vision, and the invitation to raise ourselves to the possibility that we can do more than just manage this. How did we get here is often what takes place when a history's been taken, isn't it? Let's briefly glance at this, because it's relevant. Let's look at the last 300 years on one slide, which is a bit of an achievement. As the waves of cultural change have unfolded, so the health challenges have changed, and so our response to them has changed. If we had written down on those pieces of paper back in the early 1800s, it would have written, of course, the infectious diseases. Cholera would have been killing over 4,000 people in this city per year in the annual epidemics. And then someone dreamt, that's an interesting word, someone dreamt of Loch Katrine. And how do you think the idea was received? They were mocked. It was told it was impossible. It was too expensive. It wasn't technically feasible. And anyway, this squalor with 14 to 15 people per room in Glasgow was just sort of part of the human condition and would always be with us and partly reflected the way people are. 25 years later, Loch Catron began to flow, and the next year of the next epidemic of cholera, there were 85 deaths in Glasgow, compared to the thousands in the other cities in this country. Vision and dreaming and a willingness to see off the current map are a critical part of all this generation of this. And so we dreamt and did amazing and wonderful things in other waves of public health, standing together on the shoulders of the people before us to relieve human suffering. What amazing things we've done. And yet, if we look at today's epidemics, the obesity, the stress, the diabetes, the heart disease, what's the Loch Catron we're looking for? So there's the, if you like, at this stage to our mind, impossible vision I would offer you to think about. And remember that let's look more deeply than just in the immediate management. We're in an era of diminishing returns from an old way of working. If there were these big 4 waves, we're searching, if you like, for the 5th wave. And where shall we look? Who has got the answers to this flourishing that we're looking for? Of a better way to live in the modern Western world. One place to look's under the floor. You're too fucked up. Next. And I worked for 10 years in the pain relief clinic at the Royal Infirmary, and the deal was that I would see people if the clinic had failed to help them. So I was under the floor, and my toolkit was bust, and my map didn't get me anywhere, and I had to start from scratch. And I began to realize, as the minister was saying, that I had been trained to see people's brokenness and try to fix it. And I began to undergo a transformation myself, a shift in my being and my perception of what my core job was. And I began to ask people different questions, such as, how come you're not dead? Seriously, how in God's name have you got through? What has helped you? What strength inside you has helped you do this? Could you teach me about this? Could you teach me about what hasn't worked and the care that you've had that has been unsuccessful? And I just listened and began from there what you might think of as your improvement cycle, inspired and informed. And I realized the 4 beautiful waves that remain so important were driven by a map of an external expert intervening to stop things happening, reflected in the word anti in every one of these drugs. With a question, what can we do to help the situation? Now I would say the 5th wave that we're inventing together and that this movement to person-centeredness is part of formulates a different image in front of us and a different question. What can be done to help release capacity? What is the strength within this person in this situation? And how can it be accessed, and most importantly, by themselves? And how can they begin to become skilled and empowered to work with this capacity within themselves? And I'd like you to notice that's a bit of a further pushing of a boundary beyond this tremendous step into what are your priorities as opposed to mine, critical as that is. But the person's priorities might be captured in too low horizon, just as ours is. The priority might be to manage the diabetes, where it could be that support to help the person transform their way of living could begin to help reduce the impact of that diabetes and the need for interventions of it. So we have to be careful where we place that horizon as we dream into this new era that we're creating. And most of all then, within this space, I began to learn of the human capacity for change, for transformative change and for release. Sometimes from physical illness, not always, but always from restriction and from suffering. I began to see what I called the healing response in a human being. You You could call it the growth response. And I began to place that centrally. And the studies I'm going to show you now have been modeled off that idea of placing that capacity, of studying the stages of emergent change and of recovery of spirit or of mind and of body and the possibilities inherent in that. What do I mean? Let me try and bring that to life, say, by one person's story here. This is someone who joined the Well Group, interviewed 3 months before it for an in-depth qualitative interview. She's a staff member in the NHS in the Highlands, and she tells of 36 years of struggling with depression, antidepressants annually for probably since her 20s, at times panicked, housebound, a real great depth of suffering, and yet trying to keep going. 3 months afterwards, at the second interview, a deep transformation, upbeat, life has changed, work, family, attitudes, what she's eating, off antidepressants, changed awareness, and a being with herself. As she put it, I'm totally different. The way I see things and feel things, I'm not afraid. There's a confidence coming from inside, and I'm happier with who I am. This is an example of what I'm calling a healing response, a change response in a human being. And for me, this is the horizon of what we're trying to achieve. And as we study this with people, here, for example, we are beginning to refine here person-centered measures, a range of 6 that I'll show you a few later with. But they correspond, as you can see, with these progressive rises in enablement, improvements in fatigue, psychological well-being, and so on. It's just the graphic image I want to show you, that as we get better tuned to see if our changes are improving, we want to tune to these factors within individuals, their inner life, inner experience of well-being, coping, strength, enablement, and so on. And there's a lovely range of instruments have now been evolved and stepped forward in the last 10 years. Let's hear her language rather than her own.
I'm healing. I see myself as healing. I see, this is just a personal thing. I've seen myself with like an open wound. It's never healing. Mm-hmm. And now I can see it's closing down. You know, it's like, you know, if you've got a scan, yes, it's open. Exactly what you mean. So now this is closing in and it's sealing. And that's how I feel. Wonderful description. That's how I feel. It's not open anymore.
That was at 3 months. 12 months later, the change had persisted.
Some adventure, I tell you.
I know. Since I last spoke to you, you were so happy and excited.
Oh, I'm still the same.
Is that right?
I'm still the same. And I have to say, this is the first year since I was about 20. I can't remember my age exactly, but it's the first year I've never had to take antidepressants or St. John's wort or something like that for my mood swing.
So what we've been exploring is if you place that potential centrally here and spiral outwards from it, you can begin to ask questions like, what is this? How do people achieve it? What roadblocks it? How can I set up my meeting with them to support it? What stages does it go through? What skills might I acquire? How can we design our services to support these capacities in human beings? And how do we measure if we're achieving that? And from that, then, we've been studying the self-care relationship, which we think is absolutely critical in achieving the movement which Carol is describing. And we've been structuring and modeling programs for practitioners on the therapeutic encounter and how you can better support people in these movements away from the medicalized model and into this change and healing model. And the Well group of which she was a part is an experimental scaling up from the one-to-one encounter to see if you could support people in a group environment. And from there, policy and system design and cultural change. And we're working with a sister group called the After Now Project, led by Professor Phil Hanlon at Glasgow University, looking at the cultural influences on well-being. So trying to look at these scales across that potential in the single person, our meeting, and within our systems, and further up from it. Another language that may be helpful in chatting is if we take these 4 ways we've discussed, integrated into the present moment. We could call it the first horizon. dealing with now. It's critical, keeping the lights on, the heroism of our daily work, working in the system and model that we have, dealing with the wounded people that we've got. And yet as we do it, somehow we must hold in our vision what is to come to replace this and the transformation of it. I'll call it the third horizon. And then as we go about our work with innovation and improvement, let's call that the second horizon. Acting in the now, the current situation, but holding that future potential and change that we're heading in our consciousness. So we're holding all these three horizons at once, operating with them at once. And many of the innovations that you're doing, therefore, if you like, I would nickname it an H2, a second horizon piece of work that we're all involved with. But the danger I want to say is watch out in your work. Because while, if we're successful, we go along the stormy, difficult pathway towards what will currently replace our current map, the current situation is likely to want to draw the innovation in, to extend itself, to try and keep it going and to bolster and hold it up. An absorption into the first horizon with a loss of your vision and your essence and your deeper purpose. And this, I think, is an ever-present danger for us as we move into these changes and improvements that we're after. And the quality strategy was mentioned. And what a step forward that has been. You know, to see the word compassion in an NHS document, believe me, even 10 years ago, was not the conversation that we were having. And to have person-centeredness placed in the middle of it, tremendous step forward. But in this context, I would just raise a flag of concern that I'm sure we would all share. Watch out that we don't use it to do the first horizon better only, to operate by the old map better. Somehow we must use it to support the emergence of new models, actually a shifted vision and a new way of working, a transformed way of working. This backs up what Harry Burns was saying, our Chief Medical Officer, in a recent tweet. We need consistent implementation of salutogenesis-based programs in Scotland. Salutogenesis, the creation of health. You and I were not taught about the creation of health. We were taught about illness and disease and its management and something about its avoidance and treatment, and somehow health would just emerge. But if we look at our epidemics, it hasn't proven sufficiently to be the case. And what do we need in this era of evidence-based medicine, where it's hard to move off the existing map because you don't have evidence for it, and yet innovation involves you walking off maps. It's inherently a bit of a radical thing to do, innovation. And I love this quote from the President of the Royal College of GPs, time to move from evidence-based medicine to practice-based evidence. And I would think this is very empowering for you and for us, and that we can work where we are, starting from where we are with the people that we're working with, and deeply listening to what's not working and to what's working. The currency unit will be individual stories, and samples of patients' experiences will be the true test. Graham Watt, Professor of General Practice. 30 years ago, forget it as an idea. We already are deep into change at the moment. It's a very exciting era, although the seedlings might yet to become visible for us. And as Graham adds, sometimes evidence, when we've got it, but always based on experience and underpinned by values, the deeper value. We must watch that we might become headless chickens, even in cycles of improvement where we're running around busily measuring and doing this and that, if we've lost the deeper root of what we're doing. And I want to do in the last section just little steps that we've been looking at ourselves and models that we've been taking, and hopefully you might find some encouragement or ideas within that, or be able to share ideas with us that we could do better. So I want to talk about this modelling up from the study of healing potential, one-to-one encounter. 2004, we asked the question, could you scale it up to a group-based program? The Well. And just to give you a wee flavour for that, people attend for 16 hours in Glasgow, and there's an extra day up in Nairn. And the core of what they're brought into is this sort of conversation. They'll be shown similar slides to the ones that we've looked at and confronted with the limits of the medical model. And the deep purpose will be about a journey of change and an activation of self-care. And that's more important than a particular toolkit that we might use. You could use a different toolkit. Certain forms of meditation and cognitive skills, mindfulness, and so on. The deeper purpose is this personal shift, and I'll try and give you a flavor for that. People are drawn in to ask, how could I change this situation for myself? What am I to do faced with this chronic pain and stress and suffering and inflammation and the medicine's not taking me far enough and the system rushed? The truth is, we have to look to our clients and our patients for the answer here. We need their help and we need their ingenuity to help take this forward. And they begin to understand, as we must, that this involves a change of the inner map, away from that anti-map into something new. Now that might sound psychological, but when I talk about maps that we hold that guide our vision in what we're doing, they're physiological. Here's two neurons connecting in the instance of making a thought. You can't make a thought without such a connection. But the more you think the thought, the more that myelin is laid down around the nerve. And by the time there's 30 to 50 wraps of this myelin, a new habit, the pathway is firing about 3,000 times faster than the time you first thought this thought. So helping people change includes inspiration, vision, idea, information, but much more. When they say, says this person, look after yourself, that makes sense, but easier said than done after 40 years of bad habits. We teach people an introduction to mindfulness and awareness. I won't do anything other than just sketch these. Just going to give you a little flavor. Is this a snake or a rope, people, that you're looking at? Cognitive skills and perception. The journey of self-care, the weekly course, became for me an appointment with life, a daily appointment with my life. What was it trying to say to me? We've got much to learn as a community and as individuals about the mind-body connectedness and stopping that split that's driven us for these last 300 years, and the research that shows inner life and stress impacting immune system and inflammatory response and recovery pathways, and meditation and other forms of approach being shown now to positively influence it. People are confronted about what are they eating and guided to start eating real food as opposed to processed product. I'm more mindful now about what I eat and what my husband eats. And finally, to say within the course itself, and then I'll show you a little bit of the results, but it's not my purpose here to emphasize the WELL program. It's more, I hope, to just give us an example and an inspiration of the sort of things that's possible and that so many of us are exploring. It's not what people need to do that changes the situation. What we think we're seeing is the deep question is why bother? Why bother? And the issue of the self-care relationship and self-compassion seems critical. And I wonder how you're doing with this, but we feel that we've found ways to help touch this relationship in people and help begin a real change that leads to a sustained change. And a key in this is you, the practitioner. It's activated practitioners that activate other people. It's people who are walking it themselves, acknowledging their own struggle internally. And we know from the research that two people who are in one another's company, you can even read a person's ECG in the other person's EEG in sensitive equipment. When we come into space together and into relationship space, there's so much more going on than what's being exchanged verbally. And we're glass houses and we can read one another and we know of the authenticity or the bullshit that's inside this person, even through the maze of their language and their professionalism. Genuine connection with people. And if you do measures, say, of your experience of empathy on the left, don't worry about the words, and your experience of whether you feel sparked, enabled, motivated by the consultation and the meeting, what the research we and others have been doing is showing that in 200 cases, not a single case of successful sparking, enablement, in the presence of a low empathy experience. The relationship is utterly critical. You are critical. And what's happening for us all, let's be honest, is the system. We're delivering what we're doing and the wonderful work that you're doing, despite the system, not because of it. It's our humanity and what we bring to it that matters. And if we ourselves are burning out and struggling, then what's happening in the space? People, please look after yourself and begin to think of your welfare and your balance and bring that to work. Let me just finish with some examples of ways that we've been measuring this. I mentioned the patient enablement instrument just now that averages a 3 in general practice. This was our phase 1 evaluation in the first few years. High levels of enablement sustained across 9 months after just the 4 half-day course. This is in people with chronic fatigue syndrome, improving fatigue, improving physical function. We then went on in a phase 2 result after we had established an NHS service. We did a retrospective survey and we listened again. So this is one of the cycles that you're using. And we asked people, what's important in this work? What's working? Here's what they told us and attuned us to. Understanding and coping, but self-help and awareness. And so we set up a formal phase 2, and we used, as you will be doing or could think about doing, simple cycles of feedback. This is immediately after the course, listening, redesigning, retuning, and we were seeing improving results. And then you could then introduce, you might consider something like some of these person-centered scales of sparking enablement, inner life change, well-being, the change in symptoms and fatigue, and the impact on your daily life. What have we found over 9 months? Significant positive impact across the board here, clinically and statistically, on all measures at each of the 3 time points that we've looked at. People, we can do more. We can do more. We can have the courage to dream a bit more and to train ourselves more and to listen more. And a joy and a power can come back into our work, and a creativity can come back into our work. 9 months in phase 2, even better enablement results, critically rises in self-compassion. And you can see a double baseline here, -3 months and 0.0, so stable before the course, rises in self-compassion, improvements in psychological well-being, in fatigue, in overall well-being, in overall coping, and in the health complaints. And objective measures we've been looking at showing that people are shifting their blood fats towards a higher omega-3 level at 9 months, which will mean reduction in risk of future heart disease, depression, and other diseases. We've also been showing faltering and much to learn, I think, but real potential in dropping fasting insulins, the marker of the big epidemics that we're in the middle of, the diabetes and the obesity and the heart disease. This is what people can do with just that brief intervention. We've corrected vitamin D levels. With this approach, people have made big changes. And there's much to do now. This is really just beginning, and we've got a whole range of ideas of things that we would like to do. And I think the last image, 100% of people who've done this tell us that they're sharing their learning with other people. So that's a fantastic way for us to make cultural shift and movement. And we've got a whole range of other ideas that we now would like to bring forward that time defeats me. But there's a website that would show some of these results if you were interested, and maybe share some ideas there and come into dialogue with us. If I could leave you with that. And let me say again, my deepest purpose is in celebrating what you are doing and the care that you're bringing, and the kindness and the patience and the determination to help people and take it forward. And thank you to you and to all of us for that, and my best wishes for your work today and ahead. Thank you.